Well, thank you very much for being here, and we want to start off by thanking Joe and Jim for giving us the opportunity to present this new initiative to you. This is my partner in this, Dr. KuoJan Tsao, and if we could start the slides, please. The new initiative is March of Dimes Center on Perinatal Safety. Oh, I'm sorry, I have it up here. An overview of this is that we'll talk to you about the rationale for the March of Dimes Center on Perinatal Safety, MOD COPS, and the March of Dimes Center at UTHealth and Memorial Hermann Hospital System, and a national vision for the Center on Perinatal Safety. So, the rationale: perinatal errors. Unfortunately, newborn-related errors occur at rates up to 74 events per 100 patients. And the literature says that more than half of these are preventable. We think way more than half are preventable. Pregnancy-related errors, we've been hearing about this with the panel. These increase the hospital stays by 50%, and each of these numbers has a story, an individual story, and often too tragic a story. So the National Patient Safety Foundation came out in 2015 with a report, Free from Harm, Accelerating Patient Safety Improvement 15 years after To Err is Human. And we've heard this last evening, this morning, that the scale of improvement in patient safety has been limited. The healthcare system continues to operate with a low degree of reliability, and harms to patients are frequently experienced and could be prevented. They also said that we need to move to a systems approach from a reactive approach to patient safety, and we've heard that before. But it's hard to change cultures. And what we're really doing is talking about saying that the system is the problem, not the patient. I'm sorry, not the healthcare provider. So when a patient is harmed, too often there is finger pointing, and that keeps us from really solving the problems, improving the systems. We must prioritize a culture of safety and have everyone in the healthcare system involved in that culture of safety. We need to consider the safety culture process across the continuum of the patient's care, not only in hospitals, and we'll talk about how that's particularly a challenge in pregnancy and delivery. And they conclude that despite progress, patient safety remains an important public health issue. And again, this has come up, it's a public health problem. We need to solve it, and we need to do better than we're doing now. So perinatal care is a complex system. It involves two patients, the mother and the fetus or baby. It involves at least 3 settings and more for high-risk mothers and 6 babies. These are the OB office or the clinic, the hospital labor and delivery unit, and it used to be that OBs delivered the babies that they followed through their pregnancy, but that's not necessarily the case in many instances. The hospital labor and delivery unit, and then the transfer of the mother and the baby from the labor and delivery to postpartum care and the normal nursery. And if it's not a normal, low-risk mom, then there's much, much more to this. Complexity results in increased risks of communications errors, increased risks of failures with handoffs. So we want to thank Joe Chiani and Massimo, who've expressed their commitment to the March of Dimes Center on Perinatal Safety, with Massimo as the business partner, and with Joe agreeing to serve on our advisory and review committee. And now I'll turn this over to Dr. Tsao.
Thanks, Dr. McCabe. I'm a pediatric surgeon, and you can ask yourself, why does a pediatric surgeon have any interest in obstetrics? Well, I like babies, I like healthy babies, and I like the moms that give us the babies to take care of. So as my career interest increased in patient safety around pediatric surgery, you quickly realize, I think everybody in this room knows, you peel the onion back and it goes up and up and up the stream. And as my work in prenatal health and fetal medicine increased, it became pretty clear that all the patient safety things that we were doing really has to start upstream. And so we have a tremendous interest in patient safety culture in my hospital, and we continue to try to lead that. And we came to Dr. McCabe in the March of Dimes really with a vision. And that vision is that the March of Dimes had spent so many years, decades, and money trying to treat preterm health and preterm babies and trying to improve the care of babies, but there's this tremendous gap because the babies hit the hospitals, and now you have this gap in care that really needs to be addressed. And so our work to them was that can we create a vision, a model that really can improve patient safety around increasing culture. We thought that we had a very unique opportunity in Houston, Texas. I work in a healthcare system, a Memorial Hermann system, that has put patient safety at the top of their priority list from the board on down. I work for University of Texas, where there are leaders in patient safety in our highest levels and throughout the medical school. I work in a medical center, it's the largest medical center in the country, that really is a spectrum of healthcare for mothers and babies, from specialty hospitals to general hospital that take care of mothers and babies. And then I also live in an environment in Houston where we talk about high reliability organizations all the time, and we talk about applying those principles to our hospitals, but really no one's really ever taken a very research-oriented, systematic approach of how do we implement those safety principles and safety cultures into our hospital. And so I live in an area where there is aviation, there's aerospace, there is nuclear power, there's oil and gas, and so our vision is that can we take those lessons from those industries and try to apply them to our hospital, which is a very complex system, and really have a plan and a research plan of moving forward. So our goal really is that can we provide a model around perinatal culture about safety for hospitals and healthcare organizations in a very systematic approach? Can we identify the best practices and best evidence for utilizing these high reliability organizations? And then can we identify new metrics to really say, you know what, this is how we are improving culture in our hospitals, and that hopefully the patient safety issues will follow thereafter. This is a tremendously busy slide, and I know that, and this took me a long time to convince Dr. McCabe that this was a good idea. But all these patient process improvement things that we're doing, and we have all these projects up here. Project 1 through 5 are all the core measures from the Joint Commission. We have a maternal vaccination program. We talked about delivery triage, which is really a transition of care. The panel before us really talked about how there was a fragment, and Mr. Hayden talked about how their teams were very fragmented and lost information. Is there a way that we can systematically triage patients so everybody knows this is a low risk, high risk, and what are the plans around it? And we talked about transition at home for us, and I wish I had heard this talk years ago. I would have started this a long time ago, where we have a tremendous transition at home on mothers and babies, and the whole panel before us really talked about all those concerns. Now, we could have tackled each one of these individually, just like a lot of people do, but my premise is that none of this is sustainable in the long term without a culture around patient safety in your institution. And so Project 9 is the overarching project, and we take all these principles around high reliability organizations, and can we, through education and training and research, develop a model with the March of Dimes for institutions that take care of mothers and babies to improve the patient safety culture around this perinatal continuum of care. And that is really our goal. Now, we talked about all these different advocacy groups and whatnot, and I think the one innovative thing that we will do in the future is that this is all supported not through just the hospital healthcare teams, but we're looking at industry advisors, we're looking at leadership advisors through our hospital systems, we're even looking at payers and regulatory advisors, and can we really tackle this as a 360 and say where are the real gaps, and can we learn from other industries as we continue to improve this? We realize this is a tremendous ambitious project, which is why we needed a partner like the March of Dimes to really move forward with this, and the patient safety movement to really continue to push ahead and be able to kind of tackle these kind of problems at a large scale. And that at the end of the day, is there a patient safety culture bundle that we can produce through the March of Dimes that hospitals can adopt and say, you know what, these are the components that you have to have if you want to take care of mothers and babies, to train your people, to put patients first, to put patient safety as the forefront of your daily thinking. And that is centered on perinatal safety with the March of Dimes.
So our vision for this March of Dimes Center on Perinatal Safety is not just a vision for Houston. Though if we look at the three major providers in Houston that we're hoping to bring together in partnership on this, it will impact 60 to 65,000 deliveries. So it will be an important training ground for moving this to a national organization. We see it as a hub and spoke model where there are multiple hubs nationally and many, many more spokes to get out to the delivery hospitals. What would we do with this? How would we organize it? There would be central coordination and credentialing to become a site for March of Dimes Center on Perinatal Safety. There would be webinars. There would be site visits. For the individual institutions, there would be required standards, metrics collection. We talked a lot last evening and today about measuring what you treasure, and we really need better metrics, upstream metrics, and better ways that we can look at the reliability of safety in the perinatal period. And then there needs to be regular review so that we are watching, we're monitoring, and we're making a difference. And if we're not, then we need to come up with a better way of carrying out perinatal safety so that we do make a difference. So I want to thank all of you in the room for your commitment to patient safety, but particularly Joe and Jim. We want to thank you for the opportunity to announce this. This is the first public announcement of the March of Dimes Center on Perinatal Safety, and we want to thank you for giving us the opportunity for doing it here. Thank you very much.